How are you?
I am good. Thank you so much.
Let me first.
Hello, everyone, and welcome to our meeting today. If everyone is here, I think we can give it a couple of minutes until everyone is here.
Yes, go ahead.
Yeah.
Assalamu alaikum. Go ahead, Dr. Samia.
We can go ahead and start. So, hi, everyone. Today, our agenda for today, let me share my screen if that's possible. Not sure if everyone is here from my team. So today agenda is visual loss in older adult. I'll be presenting myself. Dr. Saria Mokhtar will follow, and Dr. Salah will also be participating in that topic. So she will be finishing. Data and variable, Dr. Saria. And let me say thank you for Dr. Saria Mokhtar, who are from the Brown team. Actually, she's helping us today. So she will be presenting data and variable collection method. And then for our third topic, it's going to be presented by Dr. Amna Eisawi, which is also participating from the red team. She will be helping with that. So if everyone is ready, we can start with our first topic. Let me see if Dr. Saria, are you here? I'll be starting, but I'm just checking to see if Dr. Altraify is here and Dr. Salah, if they are here. We will be starting soon. Thank you everyone for attending today. Okay, I'll be sharing the presentation for today. Just give me 1 second. Can you see my screen, everyone?
No, only your picture.
Just one moment. Okay, let me try.
It's coming. I think it's coming because we see
Okay.
something different than the one.
Okay. Can you see it now? Is it clear for
Not
everyone?
yet. No, like we see only your picture, a picture of you.
Okay, let me try again. I do apologize for that, guys. Just give me one moment. Okay, let me start again. Okay, can you see it now?
Yeah, now it's clear.
Okay, thank you. Okay, so we'll be starting today with visual loss and other eye condition. This is a very important topic for geriatric population, so we will be covering this. First of all, our goal for today is to be able to describe the leading causes and pathophysiology of visual loss. We're going to talk about certain technique for preventing and treating visual loss. We will also try to cover signs and treatment of common eye disorder in elder population. And also in the final topic, we will be trying to cover techniques for low vision rehabilitation. What are the common eye condition in an older adult? This is things that we're going to talk about. Causes of visual loss, for example, refractive error, cataract, age-related macular degeneration, diabetic retinopathy, glaucoma, ischemic optic neuropathy. These are some of the topics we might go through during this presentation. And at the end, we will cover low vision rehabilitation strategies. Just one moment. Sorry for that. Sorry, give me 1 second. So when we talk about the impact of, I do apologize. There are certain ways. I just need the title in that. What are the impact of visual loss? So the impact of visual loss, that visual impairment by definition, which is like equity less than 20/40. The prevalence of visual impairment increase with age, and it affects about 20 to 30% of those age 75 plus years. Blindness, which is like visual equity less than 20/200, the prevalence of blindness is 2% of those age 75 plus years, and 50% of blind population are age 65 and older. Age-related macular degeneration, we're going to cover later, is the most common cause of irreversible blindness in the or throughout the developed world. So since this is a major problem and it could be prevented, it could be treated, there is a screening for that to prevent visual loss. So what is it? The American Academy of Ophthalmology recommends comprehensive eye examination every 1 to 2 years for people age 65 years and older. And about 1/3 of all new cases of blindness can be avoided through this screening. With effective use of ophthalmologic service, we can avoid these cases. So as a provider, how we see these patients, or what are the common things that patient will present with to your office? So red eye, ocular swelling, discomfort, diplopia, sudden loss of vision, and floater are the common complaint that patients present with. As a provider, you can screen with a question like, has your vision changed? After answering this question, any vision change, any decrease in vision can indicate serious condition. So what we do next is we check for visual acuity, and we can also check for afferent pupillary reflex. Any defect or afferent pupillary defect can indicate actually presence of, like if you did the test and you find any afferent pupillary defect, I will call it ABD. That is can be signifying visual loss. So what as a provider you can do in the office, you can do just simple light swinging test or swinging light test. The patient will be in the dark room. The provider will check for pupillary reflex by asking the patient to stare directly or stare in distance, and putting a bright light or swinging a bright light in front of one eye. That will cause constriction, direct constriction. This is the direct pupillary reflex, and then the other eye will be also constricting as for consensual reflex. In case if you did this test and quickly you would be swinging the light into the other eye. If the eye remained dilated, that means there is a defect. This eye is not detecting the light, or there is some certain block in the light from the eye to take this signal to the brain. So that would mean there is an afferent pupillary defect. And this could be, as we said, a significant indicator for visual loss in patient. So what are the signs and symptoms of eye condition that require immediate?
Yeah.
Yes?
Sorry to interrupt you. Your screen is frozen, like it is at the same point, like at the impact of visual loss, blindness, and visual impairment.
Okay. Was you able to see this one? Sorry for that. Was you able to see this?
It's
still frozen?
same one, yeah.
Okay, let me try again. I do.
Okay.
Sorry for that. 1 second, give me 1 second. Let me try again, share my screen. Okay. Okay, can you see it now?
Yes.
Yeah, we can. Yeah.
Okay. So we already covered this. There is a screening that we should do every 1 to 2 year. It should be done like comprehensive examination for people 65 or older. Here I did cover this part. Like these are the symptoms that patient present with, and we check for visual acuity, check for afferent pupillary reflex as I mentioned. And what are signs and symptoms that can the patient can present with, and it's an indication or it's required, that means this patient require immediate referral to ophthalmologist. So one of these thing is retinal detachment. It is an emergency. The patient can present with flashes, floater, decreased vision, and curtain over vision. Acute angle closure glaucoma is also one of the emergent ophthalmologic emergencies, and it's patient would present with eye pain or headache, ocular hyperemia, hazy, cornea, fixed dilated pupil, decreased vision, nausea, and vomiting. We should be very careful in the history in cases of acute angle closure glaucoma, because it could be precipitated by as simple as like over-the-counter medication like sympathomimetic medication, sometimes anticholinergic medication like phenylphrine, pseudoephrine. Patient will get those for common cold symptoms, and then that can cause or precipitate acute angle closure glaucoma. Ischemia or ischemic optic neuropathy. Ischemic optic neuropathy is sudden loss of vision. Could be complete or partial in one eye, and this is due to swollen optic nerve. And central or branch artery occlusion. This could be as part of giant cell arteritis or by itself. So the patient would present with sudden, painless vision loss in one eye, or in the superior or inferior hemifield in case of branch occlusion. So if it's part of giant cell arteritis, the patient will have other symptoms, so you can review that. The patient might say that they had jaw claudication, headache, transient diplopia, these kind of symptoms. And it is also an ophthalmologic emergency. Usually we treat even before definitive diagnosis if I'm suspecting giant cell arteritis by giving high dose corticosteroid. As we remember, even before like biopsies result, and we don't wait for biopsy result. For artery occlusion requires stroke protocol within 2 weeks of the event, so you should put the patient in a stroke protocol in case of artery occlusion. Retinal vein occlusion is also one of the ophthalmologic emergency. The patient would present with sudden painless vision loss. This would be diffusely if it is central, or in one hemifield if it's just one branch. Or branch vein is involved. Prominent retinal hemorrhage and cotton wool patch on fundoscopy, that would be the appearance in fundoscopy. Scleritis, the patient would come with eye redness, severe pain and tenderness, decreased vision, and it's associated with autoimmune disease. We see that with inflammatory bowel disease, sclerosing colitis, and this spondylitis and this kind of condition. Anterior uveitis, photophobia or eye redness, decreased vision, and also posterior uveitis, the patient would have floater, decrease in vision. Corneal ulcer, the patient would have like eye redness, pain, decreased vision, corneal infiltration. And then uveitis, patient would present with photophobia, eye redness, decrease in vision, and finally herpes zoster ophthalmicus. In these cases, the patient would have like eye redness, pain, burning, rash, decrease in vision. The patient will also have light sensitivity, characteristic skin lesion, which we call Hutchinson or Hutchinson sign. That would be part of the presentation for herpes zoster. So thank you so much for listening. Dr. Sarah will continue. Dr. Trevi, if you are here, can you please resume the presentation? Would you be able to share your own screen, or would you like me to continue sharing?
Yes, Dr. Sam, if you could, I would like to share my screen, if that's okay, please.
Okay. Yeah.
Thank you.
Thank you so much. I will stop sharing then.
You can try again, Dr. Sarah.
Okay. How about now? Is it showing right now, my screen?
Yes, we can see it.
I'm sorry, it's just, it disappeared again. Just 1 minute. Okay. For some reason, I can't make, oh, here, no. Okay. So can everyone see my screen now?
Yes.
Okay. Sorry, just 1 minute. Okay, so I am going to continue by for treatments of eye conditions commonly seen in the primary care. First of all, we have the red eye, which could be due to a couple of causes. It could be subconjunctival hemorrhage. In this case, we just do supportive care, supportive treatment with artificial tears. For the dry eye, we use artificial tears, and sometimes we can use also cyclosporin, 0.2% eye drops, which is an immunomodulator. Blepharitis, which is an inflammation of the tiny oil glands of the inner eyelids. For this case, we can use lid scrubs, ophthalmic antibiotics, and also in some cases when we need to use oral doxycycline. For lid malpositions or lid exposure, we use a lubricant and we refer for surgical repair for those patients. Allergic conjunctivitis, we use cold compresses, we avoid the allergen, and also we can use, advise the patient to use topical or systemic antihistamines. For viral conjunctivitis, supportive treatment is what we go to. We avoid prescribing antibiotics for those patients. And we refer to ophthalmologist if the vision is significantly impaired. Now for the chalazion, which is a slow-growing, painless lump in the eyelid. It usually grows on the inner surface of the eyelid, which is due to the oil gland inflammation. In those patients, warm compresses help, and at some instances, we would refer for excision. Herpes simplex keratitis, we need to use trifluridine eye drops and refer to ophthalmology as well. While with herpes simplex keratitis, we can use, herpes simplex ophthalmicus, eye drops, tear drops could help, and also we refer to ophthalmology here. Now for closed angle closure glaucoma, this is an emergency, so we can use acetazolamide, oral or IV, and refer to ophthalmology immediately. For floaters or flashes, we have to refer to ophthalmology immediately. It may be due to retinal detachment or vitreous hemorrhage, so this is also could be a serious condition, so we refer immediately. Sudden decrease in vision, also we refer to ophthalmology immediately. There may be a secondary cause to the vision loss, which could be like anywhere from brain tumors. So it's most important to just go ahead and refer those patients immediately. For diplopia, there are two types. If it was just like monocular, it could be a refractive effect or cataract. And binocular could be a microvascular infarct to the cranial nerve. Or it could be a giant cell arteritis or compressive tumors as well. So I advise everyone to go and just look at pictures of these conditions because some of them look very similar, but some of them are emergent. So it's good to just like look at pictures of them and so to be able to differentiate them quick when your patient comes to see you. Now we're going to talk about dry eyes, which is keratitis sicca. Tear production decreases with age. And the patient will come with redness. They feel like there's a foreign body in their eyes, and there is reflex tearing. We manage those patients with artificial tears during the daytime, and an ointment at bedtime. We can use topical cyclosporin eye drops in severe cases to treat any inflammatory causes. And blepharitis could be a cause also that could accompany dry eyes. So it is something that we have to treat as well. Now coming to lid abnormalities, it is common among older adults because as we age, we lose elasticity. And so we have, most of them, they are treated by various surgical procedures. And they are blepharochalasis, which is drooping of the brow, blepharoptosis, which is drooping of the eyelid. Those could cause deformity, just cosmetic. It could be just cosmetic, or if severe, it can even go to the extent of impairing vision. There is lid ectropion, which is eversion of the eyelid, or entropion, which is inversion of the eyelid. Those could cause discomfort as well and irritation to the eyes, but they do need to be treated surgically. Now coming to herpes zoster ophthalmicus, which is painful reactivation of the Varicella zoster virus. We will see vesicles along the ophthalmic branch of the trigeminal nerve. And there's the Hutchinson sign, which is lesion at the tip of the nose. If we see this lesion even before those vesicles appear, it could mean that it could be a strong indication that there's ocular inflammation or corneal denervation. But it can also occur in other situations, so it's not just characteristic of this condition, but it's a good sign if we see it just to look deeper. We use oral cyclovir or famciclovir to shorten the course. And the pain that occurs after the resolution, it is very painful condition. So we try to use local ointments like lidocaine or capsaicin, but we do not put them in the eye. We just like on the skin. We can also treat with systemic medications off-label, which are not the indication exactly for this type of pain. We can use narcotics, TCAs, gabapentin, or pregabalin. Okay, sorry. Now refractive errors, which are a leading cause of visual impairment worldwide. Along with cataract, those two are a leading cause of visual impairment. There are a couple of types. There is ametropia, which is myopia nearsightedness, hyperopia, farsightedness, astigmatism, which is visual distortion. There is presbyopia, which is reduction in the ability to focus on near objects. This begins after age 40, and it's caused by gradual hardening of the lens and decreased effectiveness of the muscles of the ciliary body. We treat these conditions with either eyeglasses, contact lenses, and sometimes we refer for laser therapy. Coming to cataract. Now, cataract, as I said, that is one of the most important causes of visual impairment worldwide. A patient will come with symptoms as like increasing glare when they're driving at night, let's say. There is low contrast sensitivity, low visual acuity. They have change in color perception. The risk of cataract increases with age. Also with ultraviolet B exposure, vitamins deficiencies, smoking can cause it, alcohol use, long-term corticosteroid use as well, and diabetes. So we see that 50% of patients more age above 75 could develop cataract, while 20% above 65 years old could develop it. The treatment is surgical extraction. We use a local or topical anesthesia, make a small incision, use a sonographic breakdown of the lens, and then we place the new lens. It takes less than 30 minutes and it's very effective. 90% of patients achieve vision more than or equal to 20/40, and more than 3 million surgeries are performed usually annually in the US. Now coming to age-related macular degeneration. It is the most common cause of irreversible blindness in older adults worldwide. The risk factors for it are age, as the older we age, genetics play a role, smoking, and also hypertension. We see it by the presence of drusen, which has like small yellowish white spots that build up in the retina. They're made of like lipids and proteins and cellular debris, and this is non-exudative. Or we see choroidal neovascularization. We treat macular degeneration with either vitamin supplements like vitamin C, vitamin E, zinc, lutein, dianthine. This all reduce the risk of developing choroidal neovascularization. And also intravitreal injections of vascular endothelial growth factor inhibitors like bevacizumab could use to treat the choroidal neovascularization as well. So here we see with the use of anti-VEGF, we can see here the hemorrhage, and then this is a resolution after it. So they are very effective in that. Now coming to diabetic retinopathy. Now, diabetic retinopathy, it starts to occur in patients who have type 2 diabetes for at least 10 years. 70% of those patients will have retinopathy, and 10% will show proliferative changes. Most important factor for developing diabetic retinopathy is the duration of diabetes itself and the control of the blood pressure and the blood sugars. Preventing this could be with tight control of the blood pressure, tight control of the glucose, but there is some controversy that if it is really as effective, but it is something that we try to achieve with our patients, is just try to control their blood pressure, their glucose levels. Also, blood pressure control is very important. But for the geriatric population, the tight control could lead to other problems. So this is where your judgment comes in. Also, we should optimize kidney functions and cholesterol level. Treatment for diabetic retinopathy, excuse me, sorry. Sorry, excuse me. Okay, so treatment is laser treatment, intravitreal injections, and as I said, control of the blood glucose and the blood pressure. Now there's 3 stages of diabetic retinopathy. There's the non-proliferative stage, the pre-proliferative stage, and the proliferative stage. We're going to talk about each one briefly. The non-proliferative stage is characterized by microaneurysms, intraretinal hemorrhages, exudates, macular edema. The pre-proliferative stage is characterized by multiple intraretinal hemorrhages, venous caliper changes, intraretinal microvascular abnormalities, like capillary shunting, and also capillary non-perfusion or ischemia. Here we see treatment using anti-VEGF. This is before using the treatment. We can see all those proliferations of blood vessels, and here is after. You can see how effective that looks. Now for the proliferative stage, there's characterized by new vascularization of the retina and the disc and visual loss due to vitreous hemorrhages or retinal detachment. Here is also we see the role of anti-VEGF here when for resolution of the new vascularization. We see here the new vessels, and here we see that they are resolved. And that's my part, and I think Dr. Reel will take over from here. Thank you.
Thank you, Dr. Sarah. Dr. Reel Salah, if you are available.
Hello, everyone. My name is Dr. Reel. I hope that you can hear me clearly. If not, please let me know. I'm going to share my screen. Just a second. I'm sorry, just a second. I'm sorry, I'm trying to fix it. I don't know what's going on.
If you would like me to share, I can do that.
Okay, that would be great.
Okay.
Yeah, sure. So we can save time.
Yeah, sure. Okay, 1 second. I think I'm not gonna be able to do it. Okay, now I can do it. Just give me 1 second. If you can let me just know when I reach your slide.
Okay, it's the glaucoma slide.
Okay,
Yes, it's the
sorry for
previous
that.
one.
Yep.
Yeah, this one. Okay. So glaucoma is defined as optic nerve head damage and visual field loss. An important major risk factor for this is elevated intraocular pressure. However, it's been found that many patients with glaucoma actually have a normal pressure. Glaucoma affects more than 2.25 million Americans over the age of 40, and it's the second most common cause of irreversible blindness worldwide. It's actually the most common cause among Black Americans, and it leads to more than 3 million office visits each year. The next slide, please. Okay. So there are two main types of glaucoma. There is primary open angle glaucoma and acute angle closure glaucoma. The most common form of glaucoma is the primary open angle glaucoma. It happens due to slow aqueous drainage that leads to chronically elevated intraocular pressure. It takes some time to happen, and patients tend to be asymptomatic and may suffer substantial visual field loss before consulting an ophthalmologist. And that's why it's important to have frequent checkups by the ophthalmologist so they can detect this early and prevent further vision loss. The causes for open angle glaucoma are multifactorial and polygenic. The second type of glaucoma is acute angle closure glaucoma, and this happens due to a sudden increase in the intraocular pressure. Patients present with redness and pain with acute vision loss, and they also have headache, nausea, and vomiting. This is considered as an ophthalmologic emergency, and it requires immediate referral. Okay, so for the management of glaucoma, unfortunately, the damage that has already been done cannot be reversed. So our aim is at maintaining the rest of the vision and preventing further deterioration. There are several measures that could be applied. We can use intraocular pressure lowering medications. We can use laser trabeculoplasty, filtering surgery, drainage devices, as well as ciliary body destructive procedures. The next thing I'm going to talk about is anterior ischemic optic neuropathy. This happens due to microvascular occlusion of the blood supply to the optic nerve. This happens due to atherosclerotic vascular disease or inflammation, and it results in acute vision or field loss. As you can see here, there is a swelling of the optic nerve head in a patient. Next slide, please. Okay. So the Charles Bonnet syndrome, it happens to patients who have significant visual impairment. They experience visual hallucinations. These hallucinations can be elementary shapes or complex things like children or animals. The important thing is that patients are aware that these hallucinations are not real. So, vision is essential for performing daily activities as well as maintaining independence. Therefore, it's important to help patients improve and maintain their vision. So, for low vision rehabilitation, it's available for patients who have a visual acuity less than 20/60. There are several measures that we can help patients with. We can improve lighting and provide reading material with bold and large fonts and accentuated black and white contrast. We can use magnification, we can use high plus spectacles, magnifiers, closed circuit TV, and telescopic devices. We can also use eccentric viewing for patients who have age-related macular degeneration with central macular pathology. Training to use off-center fixation. For those who have almost completely lost their vision, they can use talking devices or braille. We can also use smartphone apps to provide magnification, money recognition, and dictation functions. So just a few things to keep in mind. We should not perform preoperative medical tests for eye surgery without specific indications. Most cases of acute conjunctivitis are actually viral, so we should not just jump straight away to the use of antibiotics. If we're unsure of the diagnosis, we can follow up the patients closely for resolution. We should not place temporary or permanent punctal plugs for mild dry eye syndrome before trying other medical treatment. To sum up, visual loss occurs commonly among older adults and may lead to reduced quality of life, high medical care costs, and loss of independence. So as primary care providers, we should routinely screen older adults for visual loss, and there are widely available treatment options for the different types of visual loss. So there are going to be 3 questions here with options. I'll read the questions, then give you the options. So for question 1, an 84-year-old man is brought to the office because his right eye is red. He seems to have a cold and is sneezing. There is moderate watery discharge. He says that the eye feels gritty but does not itch. He has no eye pain or sensitivity to light. There is no baseline information on visual acuity, but he thinks his vision is unchanged. Nursing home staff confirm that there is no evidence of a change in vision. For the history, he has Alzheimer's disease. On examination, eye movements are intact. There is moderate bulbar conjunctival injection of the right eye. Conjunctival hemorrhage extends from 6 o'clock to the 9 o'clock position. He has right pre-auricular lymph node being slightly tender. Which of the following is the most appropriate management of the red eye? Antibiotic eye drops, referral to an ophthalmologist, artificial tears is needed, antihistamine eye drops. You can write your answers in the chat. D. Okay, Dr. Samia, you can move to the next slide. The answer is C, artificial tears is needed. The patient most likely has viral conjunctivitis. So usually we just treat them symptomatically And we're going to move on to the next case. Okay. A 90-year-old woman is considering whether to have cataract surgery. She's able to read large print books on her e-book reader and solve crossword puzzles, two of her favorite activities. She has bilateral wet age-related macular degeneration and receives antivascular endothelial growth factor. The left nuclear sclerotic cataract has worsened, and the vision in her left eye has decreased from 20/40 to 20/80. Vision remains 20/60 in her right eye. She is frail. She moved to a nursing home from assisted living 1 year ago when she began to need assistance with bathing, dressing, and toileting. History: she has age-related macular degeneration, aortic stenosis, asthma, and osteoarthritis. Which one of the following is the most likely outcome from cataract surgery? More rapid progression from acute macular degeneration in the left eye, correction of vision loss in the left eye, improved ability to read and solve crossword puzzles, better monitoring of acute age-related macular degeneration. Okay, you can type your answers. I think it's kind of a difficult one. Okay. Okay, there are different answers. I see A, C, D. Okay. So the answer is D, better monitoring of age-related macular degeneration. The last case, a 75-year-old man is seen for routine follow-up related to diabetes mellitus, which is not under optimal control. It's apparent that his right eyelid is drooping. He says that he has been aware of the droop for the past few months, but is not bothered by it. He has no double vision or blurring of vision. He has not noticed any difference related to sweating on the right side of his face. There is no new muscle weakness or pain. On examination, the right upper eyelid covers the cornea almost to the pupil. The pupils are equally round and reactive to light and accommodation. Extraocular movements are intact. The eyes are aligned and his face is symmetric except for the lid creases. Which one of the following is the most likely cause of his blepharotosis? Prolapse of orbital fat pad, Horner syndrome, third nerve palsy, levator dehiscence. What do you guys think? We can go to the previous slide if you guys would like to read the details again. Dr. Sami, can you move to the next slide? Okay, so the answer is D. It's levator dehiscence. Thank you guys for listening, and I hope this was useful.
Thank you, Dr. Sarah, and thank you, Dr. Reel, for the great presentation. This concludes the first topic. Dr. Nadir, if you have any comment, if anyone have any question before we jump to the next.
Excellent presentation. Thank you so much for sharing this. It's an important topic, and hopefully it will help some of you when you see your patients and perhaps your family member or those around you. Thank you so much for a great presentation.
Thank you, Dr. Nader. Okay, our next topic, Dr. Saria, if you are ready, would you like to proceed?
Yes, hello everyone. Do you hear me well? If you do, please let me know. Okay.
We can hear you, Dr.
Okay. Hi everyone. My name is Dr. Saria Mokhtar. I'm a follower in the Pediatric Fellowship from the last year. I'm here today to show you how to create and use the Google form. I will start to share my screen. Can you guys see my screen?
Yes, we can.
Okay. Sorry. Okay, let's start to talk about creating Google form for formation of survey or quizzes. Anyone who have a project or research or doing anything and he want to learn or know how the project affect people, he can use Google form to check that. I love two things about Google form. Number one, it's too easy, no need for technical background. Number two, it's free if you have a free Google form. Let's start with my slides. It look boring, sorry guys, but when we finished, we go to actual application of the slides on creating a Google form. Okay. What's a Google form? A definition is a free online tool for creating survey, quizzes, and form, or you can even use it to create a quiz for yourself to self-assess, to assess yourself when you're doing anything. The purpose of creating Google form is collect responses and organize information. The benefit that you get from Google form creation, it's easy to use. Why you use it, actually? It's easy to use, accessible anywhere, integrate with Google Sheet for data analysis. When you complete your survey and receive your responses, you can link it to the Google Sheet so you can analyze your data. The uses of Google form in gathering feedback, conduct researches, or you can use it as a quiz for educational purpose or self-assessment, as I told you before. Event registration, collect attendee information. You can see the Google form everywhere. When you go to doctor appointment, they send you like a follow-up or review sheet or application to assess their survey that give it to you. And you can use Google form as a streamlined ordering process for product or service, as I mentioned. Let's start. When you want to start creating Google form, first you have access Google form by going to Google, and in the upper left, upper right corner, you can find waffle icons, the square icons with many dots on it. When you press that form, you can go to, let me show you guys, because explanation without evidence is impossible. Here, when you open your Google account, you see my screen. Do you see it or not? Please let me know.
No, we cannot see.
Okay. Now you see it, or?
Yes, we can see it.
Yes. This is waffle icon that I set for you. You can press on the icon. You can go through two different ways. You can click on Google Drive, or you can find the form down below here in this icon. I will go back for this after I finish my slide. Okay. Step 2, you have to choose a template or start blank template for different needs. In a Google form,
I think you have to switch to the slide.
screen.
Yes,
Okay.
you have to switch to the slide. Yeah.
Okay. Okay. When you choose the creation of the form, when you press the button of the creation Google form, you can see different template. You can save time and use one of already prepared form, or you can create your own form. By creating a form, you have to start with a title for your Google form, adding a description for the form, and provide a brief description for the form purpose. And then you can go to add question one by one by press the button of adding a new questions. Choose question type, answers that you want responder to choose, and the response type, it depends on the type of the question that you use. If the question is yes or no questions, if question is answered by a short paragraph or short text, then you can use the type of response. Okay, this is the type of question and the answers. When you choose short answers, it's look like a brief text response. You can use a paragraph answers that it gives the responder more space to tell you what he think, and you can choose multiple choice questions or answers. Select one options from the list, or you can use checkbox. It select multiple options, or you can select drop down. Choose one option from the drop down menu, or linear scale rate is a rate scale from 1 to 10 to 5. It depends on what you want. Or you can use multiple choice grade, multiple question, which with the same set of options. You have to customize your questions. Toggle the required button to make a question mandatory. If you want the responder to respond to your questions, you have to press on the button, a specific one, that he can go to next question if not answer this one. Help text add a hint or additional information for responder. You can make a validation, set a rule for response, number limits, or text format. Adding section and media. You can add some section and media in your Google form. So it's make more sense when you ask some question that need explanation. and you are not here to explain everything. So you can use pictures or videos. In adding section, you use add section button to divide your form into parts. This help organize question and improve user experience. Like if you ask a question that possible answer is yes or no, and after answering this question, the responder will go to next question. We don't know, we don't want the responder to be confused. If he answers a yes, if he choose a yes answer, he can go to next question. If he don't use, or he or she not use yes answer, or he pressed the no answer, we want to know why he choose no, and then we will make some logics and add another section to that to that response, so he can go to other section different from yes section. And all this, I will explain it when I make it in real life. Don't bother yourself, guys. Also, you can add media by adding imaging video to form to make it more engaging. You can click on image or video icon to upload the files. We have a lot of setting in the Google form. We have general setting, collecting email address, limits response, 1 per person, or allow response to editing after submission. You can you have also presentation setting, show in a progress bar, shuffle question order, show a custom confirmation message about section of the quizzes. You can turn your form into a quiz after you form it, or assign the point value and correct the answers. When you finish creating your form, you can share it or send it to anyone by clicking send at the top right corner. You will see share via email, link embedded in website, or even share it with the social media as Facebook and Twitter. Response, and you see response collection. When people start to respond to your form, you will see that when you go there. Those were collect response within Google Form or linked Google Sheet, and you can monitor response in real time, response by response. Then we go to analyze your response by viewing responses. You can see there is a summary view, and you can see it as a visual chart or graphs, or you can send it to Google Sheet, so you can appear as in a row, as responses in the row. View responses, summary view, visual chart, and graph, individual response. Each view each dependent answers. You can assess every single answer in the Google Sheet or Google Sheet integration. A responder automatically populate a link Google Sheet, use Sheet for deeper analyzing and visualization. Sharing your form, sending the form by clicking on send in the top right corner, as I said. Okay. Practical tip and best practice: clarity and brevity. Keep question clear and to the point, and you can test your form by pressing review button your form and test it before sending it out. Audience consideration: you have to tailor your question to your audience needs and understanding. You have to follow up using data collected to take informed actions. Okay. By conclusion, Google Form is a versatile tool for data collection, easy to create and share. Encouragement, start creating your, as encouragement for me, start creating your own form to experience the benefit firsthand. Question and answer, and open the floor for any questions. I think you can tell me about your question after I start. Explain that in real. Or we can apply our talk in the slide in the real form. You can see my screen now?
Yes, we can see.
Okay. I will start with going to waffle icon, goes down to Google Form. Here, press on it. You can choose one of these already prepared form, and you can save time if you find anyone fitted with your form. Or you can start with a new form by press on blank form here. Now you go to this page. Here we see untitled form. So we have to choose a title for our form. Let's say we do reviewer survey about telegeriatric research follow YouTube channels. Review form for a YouTube channel, and then you can add question. Are you currently subscribed to telegeriatric research channel? And the options you choose at these questions, the answer will be yes, I'm already subscribed, or I'm not. So you have to choose multiple choice questions. When you go to this bar, you choose here and you choose yes, and go down and add no here in this button. So if the responder not know what the telegeriatric research follow, you can add photo with the icon of the fellowship group, so he can see the icon and he will remember, or you can go in search and see what is it. You can add another question to this. By clicking this button, add question. You can import some question from this, and you can add title and description from this icon, or you can add image, videos, or add section. When the responder say yes, I'm one of the subscriber, then he can go to next questions. If he choose no, you want to know why he not subscribed till now. So you have to add another section that goes with selection of answer no. That is named logic, by creating another section. So this is our first questions. Are you currently subscribing? Okay. Yes or no? Next question. You can add Can you tell me why you are not you can add another question, like let's name it additional question. Okay. Here, if you want this question to be mandatory, you have turn this on, require button. So the responder cannot go to other question if not answer this one. Then if the responder choose no, he have to go to these questions, and you can allow only no selector to go to these questions by adding section. And you can take this one. Sorry, guys. And put it here in the section. And you go back to this question and choose. Sorry. This section, let's name it not service. You can choose a response as a small paragraph, so the responder can tell you why he not a subscriber of this channel. And you can review your form after you're done with it by pressing this preview button. So you can see, are you currently subscribed? Tell me why you are not one of the subscriber if you choose no button. And you can go to next. And you find another section of question that I'm not give it a name till now. So and you go next and next until you go to the last one and you're done with the survey. Then the creator can choose customize icon to change the theme, colors, or adding more photos to the form. And then after you finished, you can send it to anyone you want to send the form for them. Maybe through email, you can copy the link and make it shorter by pressing this one, or you can share it through Facebook and Twitter. After that, after you send your form, you can see the response from here. We get 0 responses now because we don't have any real form send it to anyone. And then you can analyze your data after that according to the response. You can go to setting also. If you don't want any more responses, you can turn it off. You can manage your response through this setting. And that's it. If anyone have any question, you can ask me. Sorry if I made this complicated. If anyone have any question, I can answer it for him right now. Or you have any comment? Yes.
Hi. So actually, I was creating one along with you, but I didn't notice. How did you send it? Well,
Sorry,
how to
I
send
barely
it?
hear you.
Hello?
You want? Yes.
How to send it? Like you said, if you will share it on social media or I missed that.
Yes, you can share the form through the social media. If you
Well,
go to send here,
okay.
you see send it via email, or you can copy link and send that link through Telegram, WhatsApp, or you can go through this icon and share the form to Facebook and Twitter. You can find all this social media here.
Okay,
if you can see my screen.
Yeah, I do. Like I created one with you, but I didn't find the button how to send it.
Okay. So you can go to Google form.com, or you can choose Google Drive to navigate through there, or you can find it ready in your Google page in this waffle icon here. If you choose to go through Google Drive, you can find here a new. You can press new and start creating your form here.
Okay, thank you.
You're welcome. Anyone have any questions so far?
Thank you so much, Dr. Saria, for a great presentation. It's a great tutorial. Hopefully this will help some of you. Thanks.
Thank you very much. Thank you, Dr. Nadir.
Thank
Thank
you,
you,
Dr.
everyone.
Thank you very much, Dr. Saria. Dr. Nadir, let me please express my sincere apology for some miscommunication. Dr. Saria and Dr. Eisawi prepared the same topic for some sort of miscommunication. I'm not sure why. Dr. Eisawi still would like to participate. She have non-overlapping information she would like to add. I do apologize for everyone for this miscommunication. Dr. Eisawi, if you are here. Dr. Amna? I do apologize again, guys. Sorry for that.
No worries. Is she there?
I think she replied she just need a minute. Okay.
Yeah.
Hello, everyone. How are you? My name is Amna Eisawi. Can I get the privilege to share the screen?
You can try again. Thanks.
Okay, thank you. Can you see my screen?
Yes, we can. Thank you.
Okay, I will start. Hello, everyone. My name is Amna Eisawi. I'm an MBBS holder from Razi University, class of 2022. I'll be presenting in the same topic that's using Google, but I'm going to touch on other aspects, using Excel or currently Microsoft Forms, make questionnaires. I'm also going to talk a little bit about the approach for making a questionnaire. Okay, that's an overview. I'm not going to talk about the Google Sheets part. Okay, so first of all, I'm going to take a step back and talk about approaching how to collect data and why is data collection important, and some ideas that I think are important and that you should put in mind while writing a questionnaire. Okay, so first of all, we know that data is very important. It's the cornerstone of medical research, data collection. And questionnaires are very useful survey tools that allow large populations to be assessed with relative ease. It could be used in stuff such as identification of health trends. It could also be used in some other areas that are not medical, such as national census and so on. Okay, so while approaching designing a questionnaire, there are some things that we should put in mind. Now, things that happen before designing the questionnaire itself, such as picking a valid specific research question, obviously, picking your population or sample, and picking an appropriate sample size, then picking your data collection method, such as personal interviews, telephones, postal mails, or electronics, which is the topic of our presentation today. Okay, this is a comparison about the different methods of data collection. I'm just going to go briefly through it. Personal data collection through personal interviews obviously gives you a chance to explain complex questions and explain in visual aids to the participants. It has a higher response rate because you're sitting there, you're asking the patient directly and receiving the answers from them. However, it's expensive, it's extremely time inefficient, and it needs training to avoid biases. Another one that's telephone, allows for clarification. It has similar benefits to the personal because you can clarify the information for the patient in real time. However, you can reach a larger radius than personal interviews. It's less expensive or time consuming because you're just going over you're asking the patient over the phone. You're not using gas to go to places and so on. However, it's difficult to develop rapport because you're not with the patient face-to-face, and obviously there are no visual aids, so it could be a little bit difficult to explain some concepts to the patient. I'm not going to talk much about postal because I think it's very inefficient. It takes a long time for data compilation because you would wait for the mail to reach the patient and then wait for the response to come. It can have it could have a lot of non-responses. And the topic of our presentation, which is the electronic data. Electronic data, part of the advantage of electronic data collection is that you can reach larger targets. You can also use visual aids. So it solves some of the problems that are present in the personal, telephone, and postal. Large targets can be reached. You can use visual aids. You can have quick responses because you literally want the participants to click on the answer and type them in a couple of minutes, and hopefully it will be done. You can reach quick data compilation, and however, some of the disadvantages are non-responses because some patients may not fill the entire questionnaire. They may skip some questions and so on, and not all subjects may be accessible because not everyone is tech savvy, not everyone knows how to use the internet, and obviously there are some areas in the world in which internet can be weak or not as reachable. Okay, so now that we know about the advantages and disadvantages of electronic data collection and some of the other types, let's talk about the designing of the questionnaire itself when you're making questions. Obviously, you picked a valid and specific research question. Now, you want to ask only a minimum amount of questions. So you only ask what you need to know. Do not put too much questions to make the questionnaire boring or too long. Only ask what you need to know. The questions should be clear, concise, and without biases. It should be written in simple language so that the lowest educational level in your patient population or people with the lowest socioeconomic status are able to understand the questions and are able to solve them and answer them. You should definitely avoid using open, double-barreled questions and questions that include negative items and assign causality. Okay. What's a double-barreled question? It's a question that has two parts to it that are not related. So, for example, if I ask a patient, what chronic illnesses do you have? What illnesses do you have? So I'm not specifying chronic. What illnesses do you have? And what medications do you use? So a patient can just give me irrelevant information. They could just be like, oh, I'm taking paracetamol because I had headache and I'm taking, no. I just want the patient to let me know, for example, the example I'm using to give you a demonstration of how to use Microsoft Forms is titled Sleeping Abnormalities in Elderly Patients in the Winter. So my question would be, are you taking any medication to help you sleep? Are you taking any sleeping medication? Yes or no? Just as simple. But do not ask double-barreled questions. Okay, so the questions at the end should elicit two type of answers, or not should, but they end up usually eliciting two types of answers, either open, which is a free text answer, that's an open response, or a closed response that choosing a specific answer from a set of options similar to multiple choices. Another important point in questionnaire is aesthetics and question order. Should definitely pay attention to that. Aesthetics, we had the first presentation was about vision loss. So I want to make this example of designing a questionnaire that has an extremely bright, yellow background with white text. Even people who have perfect vision would not be able to see this questionnaire. So pay attention to the aesthetics, make it aesthetically pleasing as much as possible. But of course, we're not designers, we're not graphic designers. So you could just have a simple background, white background with black text. And the question order should be logical. So ask about clusters of similar information, then go to the next cluster of other related information. So for example, start by asking the demographic data. Name, it's your name, it's your date of birth. For example, which educational level did you reach, right? And then you ask about the medical history. You have chronic illnesses, are you taking any medication? But do not go from what's your name, you have any illnesses, what time do you usually sleep, what's your date of birth, which level of education did you reach? So try to have a logical question order in order not to confuse or have the participant be mentally strained. Okay. After you design the questionnaire, you put the questions together, you review them, you put them in a logical order, and then you design the questionnaire to be easy to answer. You review and run, you can also run a pilot study to detect any errors. Now, that's not a must. However, you can choose a small number of patients to, not patients, but participants to run a pilot study to detect if some of the questions maybe perhaps were vague, if some of the questions were repeated by accident, if, for example, some of the questions gave a negative idea to the patient, so the patients were the participants were offended and did not want to answer some of the questions. So you can go from there, from this pilot study, and review and see what you can, if there's any need for corrections. Obviously, you should involve a statistician early on, and that's related to the point we made about an appropriate sample size. And you can consider guidelines that are written on improving response rate. Here is an example of a paper that was written, methods to increase response to postal and electronic questionnaire. Some of the methods that were listed are personalized questionnaires, including pictures, not including survey in the subject line, among other things that you can use. Now, we're going to move into Microsoft Forms. Okay, so initially, this is what I found online. Initially, you could use Microsoft Excel to make surveys. However, I'm not 100% sure, but I think that this option became limited to people who have a specific subscription, that's school or organizational subscription. And now Microsoft is transitioning into Microsoft Forms, which is very easy. It's quite similar to Google Forms, but it's very easy to use. Okay. So the questionnaire creation in Microsoft Excel. Now the option is available in Microsoft Excel 365 with school or work credentials. That's obviously the Excel option, making a survey in Excel, as I said earlier. However, Microsoft Forms, and that's tip for everyone, if you don't have an actual Microsoft subscription, you can just make a Microsoft account and enter the live.microsoft website. And then you would be able to use Word, Microsoft Word, Excel, PowerPoint, and some other options. Now, Microsoft Form is included within this bundle. You can go to your Microsoft account and then click the top left part of the screen, which has the dots, and then you can click on Forms, or you can directly go to this link and log in to your Microsoft. So once you go to this link, you'll be directed into this screen, right? So this is the interface you will be seeing. Now you can choose to make a new form, or make a quiz, or import a form. You can also export the templates that are available. You can check your recent forms, your old forms, your field forms, or the bookmarked ones, and your favorites. Okay. Now, once you click on this option, which is new form, you will see this interface. As I said, it's very simple. Here are the questions and here are the responses. You can edit, add title, add your questions, preview. It's online, so it's cloud saved. So just check if your form is saved, if your internet connection is going well, if it's connecting well and it's saved in real time. You can change the style, you can collect the responses. This is basically an option to share. You can present the responses that you have so far. You can change the settings. Okay, excuse me. You can change the settings. The settings have some really cool options. You can choose whether you're accepting responses currently or not, whether you want the responses to be collected within a certain period of time. So if you have a specific start date and end date, you can also type that. You can set time duration. I think this could be more useful in terms of quizzes. So basically, excuse me. Sorry for the interruption. So basically, you would choose if you want to have the participants solve the questionnaire within a specific period of time. You could also shovel the questions. Also, I think this can be used in making quizzes. You can disable question number for respondents. You could show the progress bar. You could get email notification of each response. And you could also hide the submit another response button. So allowing participants to only submit one response. And you can customize a thank you letter to add at the end of the questionnaire. And you can also allow respondents to save their progress or edit the responses as well. Okay. Now, here is the interface. Once you click on adding the plus sign, by which you can add a question, you can add different types, choice, text, rating, date, ranking, and other types as well. And then you would notice that the interface has slight similarities to Google Forms, in which you can add the full name, the question, right? If it's a text, for example, you can duplicate and delete move it downward or upward, add an image, have the option to add long answers, make the question required, and some other options as well. Okay, now into the practical demonstration. I'm going to use this somewhat poorly made questionnaire, but just for the sake of explaining the technicalities. Okay. Now I'm going to share my web page. Okay. So here I'm opening Google Forms. As you can see, this is the interface that I have, similar to what's in the presentation. I'm going to click adding a new form. Okay, I want to make sure if everything is clear, if it's not lagging. Can you see my browser screen well? Is it clear?
Yes, it's
Okay,
clear
thank you.
and you can see it well. Thank you.
Thank you. Okay, so I'm going to make a new form. Here it gives me the stuff that I showed you just now. So I know that it's saved, so my internet connection is good. I can title my form. Okay, so no, I can't edit. I know that it's an untitled form, right? I can change the name from below. I know that the save status was last saved just now. So I'm good to go. Okay, so I'm going to name my questionnaire. Now, using the template I showed earlier from the PowerPoint, I'm going to make it sleeping abnormalities in elderly people during winter. For the description, I'm going to say that this is a research to look into sleeping abnormalities of elderly people. Into the sleeping abnormality of elderly people during the winter. And I can also add ethical consideration, such as the participants have the right to withdraw at any point. Right. I can add this ethical approval point, not to the description of the questionnaire itself, but I can write it as question. So, for example, I understand that, understand that I have the right to withdraw at any point. And then I'm going to say yes or no. This is a multiple choice question. As you can see, once I have the cursor in the question, it shows me how, it helps me edit it. Once I go outside of it and click outside, it shows me how the question would look to the person if they're seeing the questionnaire. So it's a yes or no question. Now I'm going to make it required, and I'm going to make it one answer, not multiple answers. Right, so if it's multiple answers, it's gonna turn into checkboxes rather than multiple choices. Okay, sorry. So I'm gonna take out the multiple answers option. I can shuffle options, drop down, substitute, add branching, and so on. And add other options or add an option that's other, right? And then with the other, I have this a bar in which the participant can specify the other option. Now, if I want to delete an option, I can just simply delete it. I can add pictures, insert an image, or insert a video to the question itself and to the answers. I can I can copy the question, right, and duplicate it, basically. I can delete the question if I want to. Now that's just going through the first point. Now, another cool feature in Microsoft Form is that it gives you question suggestions. Add a new one, for example, Now I'm going to ask the patient about their name, right? And I don't want a long answer. It's just the name. I want to make this question required. That's it. I want to add the date of birth. So I'm going to add the date question. Question would be date of birth, right? And I want to make this a required option as well. It's required. I don't want to add a subtitle. I can add a subtitle, add branching, and all of that stuff, but I just want to make it in this order. Now, if I want to put the okay, if I want to put the date of birth option above the name option, I can move the question up or take it back down. All right. After that, I want to add a rating. I want to add this choice question just to give you an example of having a question with multiple choices. For example, I have who's the chronic illnesses you have. You may choose as many answers as you want, as applies. All right. Option 1, diabetes. Option 2, hypertension. Option 3, no, let's just add other, and then the patient can add whatever disease they have. Check the spelling with the Microsoft editor, which is really cool as well. And then make this a required question. Now, I don't want it to be like have the option only to answer one question. I want to have the option to have multiple answers in this question. Select total options, no limit, equal to, or at most. If I want the participant to select a specific number of options, that's only 2 options, I'll use to equal to, and then add the conditioning into 2 options. So the participant should only have 2 answers, or at most, which is up to a specific number of answers as well, which I specify, but I don't want to have the limit on this question, so I'm going to keep it like this. Then I can insert an image, I can insert a video. Okay. Now, for the next part, which I'm going to have be the last one, I want to explore the rating option. Simple number. Now, if I'm using a scale, for example, this example, as I said, is sleeping abnormalities in elderly people during the winter. Adding the, okay, what happened? Yeah, I get too little sleep at night option. And then I specify whether I have 5, I would like to have 5 levels or 6. And then I would have the numbers. Then we can add subtitle to include that this is my scale. My scale as never being 0, rarely being 1, sometimes being 2, usually 3, and always 4. So I'm gonna make this into 5 and switch it into 1, 2, 3, 4. And 3, 4, and 5, so that the participant has an idea of how they're going to answer this. Because if it would just, I get too little sleep at night, 1, 2, 3, 4, 5. Obviously, you wouldn't know how to answer this question. What does 1 mean? What does 2 mean? What does 3 mean? So I just wrote an explanation. I could also add that. I could also add a question to make it to have more clarification. and just say, how much do you agree with this statement? Obviously, I can be creative. I can just make this question into branches. I can add branches, right? So go to next, the form. Okay, going back. Now I'm going to stop here, and then I'm going to discuss the other options. Now I can preview my questionnaire. That's how it's going to look. You can see it's very visually, it's nice, it's simple. The text is enlarged at one of the questions. It's just really nice. It has a really nice interface. It shows you that this is required. Obviously, the one with asterisk is required. This is how it would be seen on computer, and this is how it's going to be seen in a mobile interface. I'm going to go back. That's how to preview. Here we can style. So we can use this template, for example. I really like the simple one, so I'm going to go back to this. As you see, we can choose different templates. We can start collecting responses, right? So we can shorten the URL, the link, copy it, send it to emails, have create a QR code, have an embedded code to add it into the website, share it through Facebook, share it through X, share it through email. Going to answer one here. So this is the questionnaire, right? I'm going to answer it. Now this is the title. I think this is a research kida. This is the subtitle. This is a required part. Understand that I have the right to withdraw at any point. Yes, I do. Okay, now I know that there's this other option. I do not want it here. I just want it to be either a yes or a no. So I'm going to go back here and delete this one, right? Going here, back, refreshing the page. It's not saved yet. Now it's saved. Okay, I guess I would have to go make a new URL code, no, a new link. And now the problem is fixed. I only have a yes or no option. Now, what's your name? Amna. What's your date of birth? Pick a random date. Choose the chronic illnesses you have. None. Or you can just say asthma. How much do you agree with the statement? I get too little sleep at night. I'm going to say sometimes, and then submit. Now my response was submitted. I do have the option to submit another response. I can submit another response. Yes. Example, Samia. Date of birth. I'm going to pick a random date. Diabetes. Let's choose I get too little sleep at night, ever, and submit. Now I have submitted 2 responses. I can save my response as well. So that's an option. If participants want to submit save their response, they can do that as well. Now I have sent it. Now I can use this option present to have the responses presented to me. This extremely nice visual representation. So this is the first question. I understand that I have the right to withdraw at any point. Yes. Can have it as bar. So no one said no, 100% yes. The next question, the names, the dates of birth, Obviously, this may not be as valuable when adding the responses to for data analysis, but it does show you the data in a very nice way. So 50% of people chose diabetes, 50% of people chose other. And then you would see also the response rates of the other option 1, 2, 3, 4, and 5. I think that's because it's a rating, so it's added some sort of statistical representation of 1 to 3. Maybe the mean, maybe the median, I'm not sure. But it shows you that 50% of participants chose 1, and then 50% chose number 3. Now, I'm done seeing the responses. I can go to this section. I can duplicate this questionnaire. I can use the settings, right? So I'm currently accepting responses, so I'm going to check accept responses. However, I want this questionnaire to be collected during winter months only. I'm going to collect it. I'm not sure exactly when winter months start, so I'm gonna just say from November. 12 a.m. And I want it to be collected till the end of March. So I want it to be collected during the winter time frame. I can set a time duration, but I think this is not very practical because I'm not making a questionnaire. I'm not making a quiz. I'm making a questionnaire. I don't need to shuffle the option, and I would like all of the participants to only submit one response per participant. So I'm going to hide the submit another response option, and I'm going to allow the respondents to edit their responses. Right? So this is basically what we can do. Now here I can check my responses again. I can open the results in Excel. It's very cool. View responses in Excel for the web. It's going to take me into this page. Okay, it's loading, but okay. Okay, there's a technical issue, but however, we can open this in Excel. I can download the copy as well if I want to use the offline option. It gives me statistics here at the top. I've had 2 responses so far. The average time to complete was 0.35 seconds. Closed status. Okay, now here I have a very nice chart, a presentation with charts to show the answers to each question. And I can see if I want more details, being that the ID number 1 anonymous name responds with yes. That's a very cool kind of representation because you don't know the actual name of the respondent in this view, so you're going to be less likely, obviously, because when you know the name, you might link it up with someone you know. It's just going to be anonymous in this interface. It's really cool. Then you would see that they both responded with. Okay. I can view the results here. Again, that's the first questionnaire. Then I can go to respondent number 2. Again, anonymous. However, I do have the name here, so I can see the full response that was given to me basically through this option, through the view result option. So I can delete responses, I can print summary, and I can share a summary link. Okay, that sums up the practical demonstration of how to use Google Forms. It's I really like the interface. It's very simple. It's designed in a really nice way. Okay. I'm going back to the presentation. Okay. Now, after that, I can edit my data. Now, I'm just going to go briefly through this. Obviously, in Excel, I can have this descriptive statistics, such as calculating the mean, median, and standard deviation. After exporting the results, I can have the data put into tables with what-if scenarios. I can make pivotal tables and charts. I can have and can use some other statistical functions just to further analyze and analyze my data, basically. Now, this is just a picture depicting how data would be seen. Charts in Excel. That sums up my presentation. Thank you very much for your attention. I hope that was beneficial. And please, if you have any questions or if you have to add any points or have any inputs, feel free to do so. Thank you.
A spectacular presentation, Dr. Eisawi. Thank you very much, Dr. Nadir, and everyone. If there's anyone has a question, please go ahead.
Excellent presentation. Thank you for sharing.
Thank you.
If no questions, we can move on to the last topic.
Okay. So if no one has a question for Dr. Eisawi, we can proceed with our last agenda for today. And we are going to cover actually how to use AI to help with interview skills. So first, I would like to introduce myself to everyone. There are a lot of new fellows. My name is Samia Alajab, and I'm a graduate from Saria University. I graduated actually in 2008. I applied last year for internal medicine residency. I got matched from my first cycle, and I do really appreciate being part of this program. I appreciate Dr. Nadir's help. And one of the tools I was able to use and actually helped me a lot through my application process, through the interview process, was using artificial intelligence. Bard, ChatGPT, I use both of them, not only during the interview or to help me through the interview, but also during my ERAS application. So what I used to do is that whenever I needed to express myself, when I found any difficulty, I will take the content that I would like to write down, or I will write it down in ChatGPT, and I will ask for editing for different expression. I will choose word from there. Sometimes I just check for spelling. So you can give certain instruction. You can take certain question, certain prompt, put it in ChatGPT or to put it in Bard, and give it a specific instruction of what you would like for it to check. So for my ERAS application, I would write about my experience, and I would take it. Please check and edit for grammar, for any error in the construction, and it will fix it for me. So it was a great help using AI. So if I can share my screen here. 1 second. So are you able to see my screen?
Yes.
Okay, so this is a Bard. It's one of the tools that you can use actually, and it can help you a lot if for certain people who might need this. So let's say I have an interview question that I need help answering. There are many Google Forms. There are many websites that have interview questions that you guys, my advice is to start reading from now, preparing for to have answer for these questions from now if you have time. The earlier you start, the more important is this is going to help you a lot during the interview season. One of the websites that you can use is Resi. You can choose to use Google to search for interview, and you can specifically ask for residency interview questions, and you can specifically ask for internal medicine or family medicine or pediatric medicine, because sometimes the question might be different. There are many questions, but you can see if it's a personal question, if it's a behavioral question. So one of the things you can ask here is like, please help me answer, let's say, an interview question for, let's say I wrote down for internal medicine interview. And then you can say, let me see, let's say, tell me about yourself. This is one of the personal questions that most of the time you can get. And if you don't have an idea how to express this or how to talk about yourself, or what exactly you need to say in this kind of question, you can ask the AI, and it can give you certain idea of what things that you can talk about during this question. So, and you can add more information about it, specifically what do you want to say, and can help you generate an answer. So these are the thing that you can get. It give you an example at the end. You can use this kind of example to introduce yourself and write an answer, and then come up with a final answer and practice saying those answers. This is one of the things that you can use. ChatGPT can do the same thing. You can also put on the same prompt or different prompt. Here is like I said, okay, so I'm going for an internal medicine residency interview. Can you help me come up with a question for like the program director? And you can give him a specific instruction, like I would like 3 questions, or I would like this type of question. So this is my personal experience with using AI, ChatGPT, Bard, and there are many other forms that you can use. If Dr. Nadia would like to speak,
Dr. Samia,
anyone else.
Dr. Samia,
Yes.
can you ask maybe Nesreen? Hello, Nesreen, Dr. Nesreen, mute yourself. And or Dr. Samia, can you go to participant and you can mute the Dr. Nesreen? Okay, go ahead, Dr. Samia. Thank you.
Okay, so this is my personal experience using AI. Actually, as I mentioned, you can give it a specific prompt, you can ask specific question, and you can give more detail about what you would like to say to make it personalized answer. And you can choose what you would like to say, and you can select what suit you, what represent you from this answer. This is from my personal experience during last year application process and interview season. Thank you so much. So if Dr. Nadir or anyone else would like to add to this or
Thank you so much, Dr. Sami, for sharing your experience. And I think it's a very good tool that we can use to improve our application, for instance, or maybe even our preparation for the interviews. So I put some questions on the app in the agenda that you can use as examples for prompts that you can see if the chat GPT or Bard can give you some input or some tips so that you will be ready. Any other comments, questions? Thank you so much, Dr. Samia, for a great presentation.
Thank you, Dr. Nader, for giving us this opportunity. If no one have any question or anyone would like to share their experience using AI during last season or during their career process, if anyone would like to share, they are welcome. If not, we can proceed to project update if anyone would like to update Dr. Nader with their project. Thank you.
Hello, Dr. Nader.
Hello, go ahead.
Hi, I have an update regarding the effect of vitamin D on low back pain project. I have done with the research strategy, and I have sent it to the email of you for your revision and if you have any additions. And I have a question regarding the search engines and the databases we will search on. Do you want to add anything to Google Scholar, Cochrane, and PubMed? Any others you recommend?
I think we can start with this. There are a lot. There are more data sets or databases, but for now we can use this. And the way I look at it, I can share. You search similar topic and how did they do the systematic review. So if you look up a couple of articles in the area where they used systematic review, you look at the first method section and they will list all the data sets of databases that they were available at the time. That's another.
Okay,
for now.
Great.
Thank you.
Okay.
At your, I got your email. I'll look at the.
Yeah. I have another question also. When I searched it, I found that there is a systematic review which was published in March 2018. So when we start to search, should we start to search within the time frame of after March 2018?
Yes.
Okay.
It's the best way to do. Unless you want to limit with certain aspects different than the way they did it. But for now, I think the time period will be after they finished.
And when we start writing about our project, we will mention that there is a study that was published and we are updating this study, yes?
Yes. So that's a contribution to the literature. Yes.
Okay. Okay, got it. Thank you.
Thank you so much, Dr. Nihal. Any other updates or any other ideas, questions, comments?
Hi, I just put my comment on the chat, but I just wanted to get in touch because I'm relatively new and I'm not sure, I'm not familiar or haven't gotten any instructions on what my project is yet. So how do I go about this?
It's a good question and welcome to the program. So basically, it's an option for you. You can start your own research project if you have some ideas, or you can join some of the ongoing projects. Let's say Dr. Nihal now, she started and she is creating a new team for her project. So when you will say, I'm going to contact Dr. Nihal and see if that project is in alignment with your interest. If so, if she has room for you, then you join that team. And there are other projects that are going on as well. If you want to start your own research project, you can come up with the idea and then you can create a team. Same way Dr. Nihal, for example, start her team. And then you can identify the task for your project and divide this task between the team members and then identify a deadline. For example, if you want to submit it to a conference, then we will look at what conference and what the due date or deadline for submission of the abstract. Or if you want to complete it as a manuscript or paper, then you think about what journal, and then you try to be like put a timeline as far as we can write this section, this section, this section, and complete all by the end of August, for example, so that we can submit something like that.
All right, perfect. Thank you.
Thanks. Any other questions? If not, then Dr. Ahmed is he here? No, he's not. Okay. So I'd like to thank you very much, Dr. Samia, and your team, all the presenters from today's meeting and all the attendees. Thank you so much. And I'd like to thank those who will watch the recording later. Dr. Samia, anything to add? Thank you.
Nothing else. Thank you so much, Dr. Nader, for giving us this opportunity. Thank you to everyone who participated today, Dr. Real, Salah, Dr. Sarah Turefi, Dr. Saria Mokhtar, and Dr. Amna Eisawi. I do really appreciate your help, guys. And thank you, everyone who attended today. Nothing else. Thank you so much. Have a good weekend.
Thank you so much. And again, if you have questions, if you have any thing you want me to help you with, or the seniors, reach out to them, or you can email me and text me or call me. I'll be happy to help. Thank you. We'll see you next week. Assalamu alaikum. Fi amanillah.
Assalamu alaikum. Thank you.
Thank you so much.
Thank you. Assalamu alaikum.